Just try and share my screen here and get us set up.
And as she's getting set up, I'll just note that we're going to record the session for those who weren't able to join us today. So if you don't want to be on screen, please feel free to just go to a black screen and join in that way.
Okay, can you see my full screen? Including, like, if my mouse is over here, you see it squiggling on the right? Yeah, okay. Okay, great. I see somebody nodding. Thank you. So just to begin, I am a family doctor at Women's College Hospital, and I work at a clinic called the Crossroads Clinic, which serves newly arrived refugees here in Toronto. And I've been doing some of these webinars and also having a lot of conversations with my patients about the COVID-19 vaccines. And, you know, I think we're all here today because we recognize that COVID-19 has had a disproportionate impact on newcomers, refugees, and neighborhoods where there are higher numbers of racialized groups, where neighborhoods where there is lower income, higher density housing, that we've seen a real disparity in how COVID-19 has affected our communities. And I think that we acknowledge and mourn the immense suffering and inequity that has played out in COVID. And I see some of this work around getting this vaccine outreach as trying to ameliorate and address that inequity and try to right some of the failures that we've had for a long time in terms of racial and economic related disparities, but specifically around COVID. So I want to also start out by acknowledging that it's good and okay to have lots of questions about the vaccines. And in this presentation, I think that probably it makes more sense to, I'm so sorry. If you're not speaking, would it be okay to mute? It just is a bit hard to hear. I think if everyone is able to do that, or maybe, there we go. Okay, great. I'm sorry, where was I? Yes, so I want to really normalize that it's okay to have questions. It's okay for you to have questions. It's great to be having these conversations with community members. And there's good reason to have questions. It's confusing. There's a lot of information that is swirling around. And some of that information is accurate and some of it is inaccurate. And sometimes it can be really hard to tell the difference and to, you know, which source do you trust? So I hope that this presentation is helpful in addressing some of the questions that you may have or that you're encountering in the community. Some of the questions I may be answering that you already know, but maybe giving a way of explaining it to folks so that you can have these conversations with the community members that you are supporting. So I think that we'll try and keep some of the questions to the end, unless there's kind of a burning clarification question as I go along. But the questions that I'm going to be addressing in this presentation have really emerged from the questions that I have been hearing from my patients, from our community members, from our partnering settlement agencies and shelters. And I think they may resonate with some of the questions that you have or that you're encountering in your work. So to start off with, how do the vaccines work? So as I'm sure you're aware, and as we're hearing about on the news, we have 4 different vaccines that are approved in Canada. So we've got the Pfizer, BioNTech, and Moderna that were previously approved in December. They've been around a little bit longer, and these are the mRNA vaccines. And then a little bit more recently, we've had approval of AstraZeneca and Johnson & Johnson, both approved. We're still awaiting the arrival of Johnson & Johnson. And these are known as the viral vector vaccines. Okay, so 2 main categories of how the vaccines work. So, but the basic premise around COVID vaccines is that they are teaching your body what the COVID-19 virus looks like so that you can fight it off if you come into contact with it in the future. Okay, so how does this work? You're all probably familiar with these pictures of the COVID-19 virus. It's got these little spike proteins on the outside. Think about the spike protein as being like an ID badge that tells everyone, hey, I'm the COVID-19 virus, okay? With the two different types of vaccines, what they do is they are giving your body instructions on how to make a copy of that spike protein. So in the case of the mRNA vaccines, mRNA, messenger RNA, it's like a little sticky note, a little temporary instruction sheet that goes into your cells and tells your body how to make that protein. In the case, and then you get rid of the sticky note. You don't need those instructions anymore. In the case of the viral vector vaccines, think about it as, you know, the viral vector. It's an inactivated virus that's harmless, not going to reproduce itself, but it's like a delivery truck for delivering the instructions to make that little spike protein. Okay, so then in your cells, your body makes that little spike protein, that little ID badge, and displays it to your body. And your immune system, your body's defense system against infections, says, hey, that doesn't belong to my body. That's not supposed to be here. That's an intruder. And it starts to build up antibodies and T cells. It builds up its immune response so that in the future, when you or if you come into contact with the COVID virus, the real COVID virus, your immune system says, hey, I remember that spike protein. I remember that little ID badge of COVID-19. No way, you're not coming in to make me sick. And it fights it off. Okay, so that's how they both work. Now, I've encountered a lot of questions about whether the vaccines affect our DNA. And again, if we remember how DNA, mRNA, proteins work, so DNA, it is our main guide instruction manual for our cells. mRNA is that little instruction sheet for making proteins that goes to the kitchen. And mRNA is, what's being delivered through the vaccines. It never goes back into the nucleus. It doesn't incorporate into your DNA. So we can confidently say, no, the vaccines do not affect our DNA. Another thing to remember is, as I said here, once you've made that spike protein, you don't need the contents of the vaccine anymore. They were just that instruction manual to teach your cells, to teach your body what the virus looks like. What remains in your body is your immune system's memory and recognition of the COVID-19 virus, okay, your own immune system response, but the contents of the vaccine, they're eliminated from your body. And I think this is important because it helps to explain the answers to some other questions around, pregnancy and fertility, for example. So can we get COVID-19 from the vaccine? Another really common question. Well, I hope this explanation previously has helped answer this. So the answer is no. Why not? Well, the COVID vaccines, they don't contain the COVID virus. They just contain those instructions for the spike protein. Just that one component of the virus. They're not even instructing your body to make the full virus, just that little spike protein, just that little ID badge, okay? So you can't get COVID-19 from the vaccine. How effective are the COVID vaccines? This is constantly in the news. So I'm gonna just kind of run through the studies a little bit. So in terms of the mRNA vaccines, the Pfizer, BioNTech, and Moderna, they were huge studies, okay? More than 40,000 participants, more than 30,000 participants in Moderna. And studies for vaccines are normally 6,000 to 7,000 people. So these were much bigger than regular studies. They involved individuals 16 years and over, 18 years and older, and people got the 2 shots. Now, how do these big trials work? Well, what happens is half the people get the vaccine and half the people don't get the vaccine. And then scientists follow what happens in those two groups. So what kind of side effects do they get? And do they get sick from COVID? And here's what they found with the mRNA vaccines. So for about 95% effective in protecting against COVID-19 illness, okay? And this was consistent across different age, gender, race, and ethnic groups. This is remarkably effective. So this means that people who were got those 2 doses of the COVID-19 vaccine were 95% less likely to become sick from COVID-19 illness, just like even developing a cough from COVID-19. This is incredible. Okay. In terms of the AstraZeneca and Johnson & Johnson trials, they, again, were huge studies. As you can see, they involved individuals of 18 years and older. In the case of AstraZeneca, people got 2 shots. And for Johnson & Johnson, it is a 1-dose vaccine, okay? So that's what they looked at. And what did they find? Well, they found, again, that these vaccines were very, very effective. Pooling together the different studies for AstraZeneca, and you've probably heard different percentages, but this is kind of putting that information together. It's about 79% effective in protecting against any type of COVID-19 illness, like getting a sore throat, okay? Any symptom. For Johnson & Johnson, you can see that there was a range depending on where the study was conducted, 61 to 72%, okay? These are excellent numbers, very, very protective. Now, I know what you're saying. Okay, Vanessa, you just told us that some vaccines are 95% effective, and now you're telling me another one could be like 61% effective. What's really, really important to recognize is that we're not comparing apples to apples. These studies were conducted at different times and different places. And what was really different was the presence of variants in the AstraZeneca and Johnson & Johnson vaccine trials. So if we maybe run those Pfizer and Moderna trials at this time, the efficacy might have been a little bit lower in protecting against COVID-19 symptoms. Okay. What is also really, really important to recognize is that these numbers that I've quoted right now are about, do you develop any type of mild illness? But the thing that we really care about is how well do the vaccines protect us against getting really sick, getting hospitalized, or dying from COVID. That's what we really care about. If you get some sniffles, well, we can deal with that. But what we want to prevent is that you end up in the hospital, right? So how effective were they in protecting against hospitalization? Basically 100% effective for all of them. You'll notice in Moderna, it's 97% effective. There was one case in the studies that emerged later on that one person got hospitalized. It's actually unclear whether it was really related to COVID or not, but just in transparency, I'm putting it up there. So all 4 extremely effective in preventing severe disease from COVID. And that's what we care about, okay? There are things that we are still learning. And this is part of the reason that it's so confusing to kind of navigate the information about COVID. Different reports are coming out all the time. And you know, on the one hand, that's confusing and sometimes it feels disconcerting, but really we're just seeing science play out in the media and in real time. This happens all the time in science. We continually study, we continually learn, things are refined. So this is not different than other scientific investigations. So what we're still learning is how effective are the vaccines against new variants. There's evidence that they are a bit more protective against the variants that originated in the UK, perhaps less so with the variant that originated in South Africa. It's something that we're still learning. How long does the vaccine provide immune protection, and will we need a booster shot? Well, that's something that we are actively studying. We know that it provides at least several months of protection, but we need to continue investigating this. Will we need a booster shot in a year, in 2 years? Well, still figuring that out. Do the vaccines prevent spread of COVID-19? Again, something that we're still learning about. We see promising results that it actually reduces the spread. So, I get vaccinated, I get exposure to COVID, I don't get sick from it, but can I pass it along to somebody else? The original studies didn't look at that. They didn't test everyone just to see if you have COVID-19, but we're finding increasingly that they probably provide some protection against spread, which is fantastic. That's really going to help with halting the pandemic. So what are the side effects of the COVID vaccines? The side effects are similar to the types of side effects that you get from any other vaccine, from the flu vaccine, the tetanus vaccine. So, most commonly a bit of a sore arm, maybe getting a bit of a headache or achy muscles, feeling a bit tired, maybe a bit of a low-grade fever or chills, maybe some nausea, vomiting. More rare is getting a little bit of inflammation or swelling where the vaccine went in. And these side effects typically resolve in 1 to 3 days. So it's short term. And I think we can really reassure our community members, our patients, our clients that this is similar to what they experience with other vaccines. That, if you have a bit of a sore arm, if it's okay for you to regularly take acetaminophen or Tylenol or ibuprofen or Advil, that you can take that for the side effects. Just make sure that they're already okay to take those medications. And this will help with these rather mild side effects, okay? In my experience, when I was fortunate enough to get the vaccine, I had a sore arm and I felt tired for about 2 days. But I still went to work, did all of my regular activities, and then I felt better. And I would say that's the experience of a lot of people. There are lots of concerns about serious allergic reactions like anaphylaxis. So anaphylaxis is that life-threatening allergic reaction of airways swelling and closing, and then causing difficulty breathing. This is exceedingly rare. Okay, it's on the range of about 2.5 to 4 in a million cases. With any vaccine, it's about 1 in a million. So the risk is not 0, but it's very, very rare, right? There's also the risk of having a severe allergic reaction with different types of food that you haven't tried before. So, it's always balancing benefits and risks. People have asked, well, do we really know enough about the vaccine? And as you saw, those studies were huge, thousands of participants, but also around the world, we are administering millions of doses. So as of April 4th, 665 million doses of vaccines have been provided globally. Now, these include other vaccine brands outside of the 4, but there are millions of those 4 that have been administered, and we're seeing the same side effects that I mentioned. The other important point, sometimes people ask, well, what are the long-term effects of these vaccines, right? We don't really know that, do we? So looking at all the other vaccines that are developed, if there's going to be a side effect from a vaccine, it almost always occurs within 6 weeks after receiving the vaccine. In rare cases, about 3 months. In the vaccine trials, we followed people for more than 2 months after they got their second dose, or their Johnson & Johnson after the first dose. And we didn't see any additional concerning side effects emerge. So that also feels very reassuring. Yes, there hasn't been years and years of seeing what happens, but we don't expect there to suddenly be some strange side effect to emerge in 6 months. This is just based on the way the vaccines work. So are the vaccines safe for people with certain medical conditions? This is a really, really common question that arises. So not only did the studies include individuals of various ages, gender, racial, and ethnic groups, they also included people with a wide range of health conditions: diabetes, asthma, high blood pressure, heart disease, arthritis, like many, 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 many conditions. And they also found that they were safe and effective. The studies, the original studies, did not include some very specific medical conditions. That's immunocompromise. So either from an immunocompromising condition or medication. So let's say you have cancer and you're on chemotherapy to suppress your immune system, or autoimmune disorders like multiple sclerosis, and maybe you're on a medication again that suppresses your immune system. So individuals from these very specific groups were not included in the studies because we wanted to establish the effectiveness and safety of the vaccines in individuals who have their immune systems working. And this is, again, this is how we do vaccine studies. This is how we do medication trials. So they weren't included then, but people now with these conditions are safely receiving the vaccines. And in fact, it's recommended that they receive the vaccines because they may be at higher risk for getting sick from COVID. Okay, so what we recommend in these situations is that if individuals have questions about these conditions, immunocompromise or an autoimmune disorder, that they talk to their healthcare provider to just ensure that it's safe, or is there timing of when they receive the vaccine and when they receive their chemotherapy, for example. So have that conversation with their individual provider. But conditions like diabetes, asthma, go right ahead. You can have the vaccine. If people have questions about this and they're asking you, I would encourage them to follow up with their healthcare provider so that they can talk about their particular circumstances, and that might make them feel safer and more comfortable. And that's totally fine. Another big question is around, can I get the vaccine if I'm pregnant or breastfeeding? Okay, so again, in the studies, they didn't initially include individuals who are pregnant or breastfeeding. And again, this is just how we do vaccine trials, how we do medication trials. But subsequently, the vaccines have been recommended by big organizations like World Health Organization, the Society of Obstetricians and Gynecologists of Canada, and many other expert medical and scientific groups. Okay, why is that? Well, based on how the vaccines work, go back to those initial slides, it's very unlikely that they would pose any specific risk to pregnant or breastfeeding people, or to the growing fetus in the case of pregnancy. Right? Again, the vaccine isn't staying in the body, it's not affecting DNA or genetic material. And what we do know is that there are risks of getting very sick from COVID-19 during pregnancy. And so what we want is actually for pregnant people to be protected against COVID-19 illness by receiving the vaccine. There are further studies that are underway to continue looking and establishing the safety. And this is, again, a circumstance where we would recommend that individuals talk to their healthcare provider about this. Similarly, I get a lot of questions from people who are planning to become pregnant. Is this going to affect my chance of becoming pregnant? Is this going to affect a future fetus, a future pregnancy? And again, the answer is no. The vaccine isn't staying in your body. There's nothing that would, there's no mechanism to suggest that it would have any negative impact. And actually what I tell my patients is, this is a great time for you to get the vaccine. I want to make sure that you don't get sick from COVID while you're trying to become pregnant or when you become pregnant in the future. So get that protection now. Should I get the vaccine if I've already had COVID-19? The answer is yes, yes, yes. Even if you had COVID-19 in the past, we don't know how long you'll have that natural immunity, those natural antibodies. There are cases, rare, but there are cases of somebody having had COVID-19 and then months later, they get it again, right? So this is why we suggest getting the longer term protection that the vaccine provides. How were the vaccines produced so quickly? A very common question that arises. So, it's a great question. These vaccines came out faster than any others. The main point here is that processes were made more efficient but no steps were skipped, okay? Actually, I hope this becomes a lesson to the world in how we can address problems more effectively and efficiently to bring solutions to the people that need them. So what happened? Well, there was lots of money. That makes a big difference. Normally we have to struggle to raise a lot of money. Money was pouring in. So one problem already solved. Another issue, there was a lot of international collaboration. Scientists around the world were sharing ideas, sharing data. That moved things along. The virus genetic sequence was identified very early. We were able to say, this is the COVID-19 virus, this is the genetic sequence, and that helped us to build these vaccines very quickly. Also with the mRNA vaccines, the mRNA technology has existed for about 3 decades. So it was very easy to just adapt that for the specific COVID-19 virus once the genetic sequence was identified, and to make those the mRNA vaccines. And similarly, a viral vector vaccine, that's another technology that has long existed. So it's just taking the existing technology and adapting it. And then a really important thing was that there was an efficient review process by agencies like Canada Health Agency. So what happens is, in order to get approval of any medication or vaccine in the country, the scientists and drug companies that make the vaccine, they do their studies, they produce their data, but then a federal agency needs to approve it. Usually that happens slowly. People take weekends, they take breaks, they finish everything and then they release the data. In this case, they removed that bureaucratic red tape and the data could be processed efficiently. Not skipping any steps, but just doing it efficiently. So were the vaccines tested in diverse populations? Again, this is a big question that comes up in my clinic. So I'm actually just presenting the data from the studies directly here. I'll note that some of the terminology that's used here may not be the terminology that we use in our communities or in the Canadian context, but these were the terms that were used in the US-based studies that were published. And another thing to note is that they were self-identifying. So they could say, I identify both as Latinx and as multiracial. So this is why the numbers don't add up to 100%, okay? So as you can see, and I won't go through all of the numbers, but they included a wide range of racial and ethnic backgrounds. And the really important point is that the vaccines were found to be equally effective in people of these different backgrounds. And similarly, when we look at the AstraZeneca and the Johnson & Johnson studies. So what's in the COVID-19 vaccines? Another great question. So in the case of the mRNA vaccines, remember that medicinal ingredient is the messenger mRNA, that little instruction sheet to make the spike protein. And then it has some non-medicinal ingredients like fats, salts, sugar, water. For those who like the science, here are the chemical names for Pfizer and for Moderna. And I'm going to draw your attention to polyethylene glycol, and I'll get back to it. In the case of the viral vector vaccines, the medicinal gradient is a modified adenovirus, a modified cold virus that doesn't cause harm, that doesn't reproduce itself. It's just the delivery truck to bring the instructions to make the spike protein. And then similarly, non-medicinal ingredients, salts, acid stabilizers, emulsifier, sugar, water. It sounds like cooking. In the case of AstraZeneca, these are the chemical names, and for Johnson & Johnson, okay? So I said I wanted you to remember what polyethylene glycol is. So polyethylene glycol is a common substance that, the other name for it is PEG, that's found in laxatives like Restoralax or Laxaday. It's in bowel preparation. So if somebody's ever had a colonoscopy, they've had PEG. It's in certain cosmetic products like creams and makeup. And it's in the coating of a lot of common medications. So it's So for example, Advil liquid gels or Tylenol gel caps. Now it's not the Tylenol and it's not the Advil that's the problem. It's the coating. So why am I telling you about PEG? It is one ingredient that we say, if you have an allergy to PEG, we need to have a medical review in how to get the vaccine safely. The reality is allergies to polyethylene glycol are exceedingly rare. I've never met anyone with a PEG allergy. And if you have a PEG allergy, you would know it because you've encountered PEG probably many times in your life, okay? So it's not really something to worry about for the vast majority of people. Similarly, with polysorbate 80, which is in the viral vector vaccines, this is a common substance that's found in food products like ice cream and gum, certain cosmetic products, and in a lot of other vaccines like the flu vaccine. So again, if you have an allergy to this, we need to do some special allergy testing, just a plan for you to safely receive it. But you will know if you have a polysorbate 80 allergy because you've encountered it. And it's very, 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 very rare. Never met anyone.
And that's going to be the 5 minutes.
Okay, perfect. I'm almost done. What's not in the vaccines? No food products, no nuts. So somebody says, well, I've got a peanut allergy. Can I receive the vaccine? Yep. No peanuts in the vaccine. You don't need to worry about it. No antibiotics. So somebody says, I've got a penicillin allergy. Is it safe? No problem. No penicillin in the vaccine. There's no thimerosal, no formaldehyde, no fetal cells, and no microchips. So what do we do if somebody has a pre-existing allergy? Well, if somebody has had a severe allergic reaction to anything, like peanuts, whatever, we just recommend, why don't you wait 30 minutes after receiving the vaccine instead of 15? We've got medical personnel who are always on site that can deal with any allergic reactions if they arise, okay? If there's gonna be a severe allergic reaction, it will almost always happen within those 30 minutes. So we're there to attend to it. And I think this is a way of helping people feel safer. And if they have any questions, well, I get hives, just tell them, just wait 30 minutes. It's safer for you. You might feel more comfortable. That's okay. That's what we're here for. So I mentioned there are just a few rare circumstances where we would recommend caution in terms of the COVID-19 vaccines. So that's if you've had a severe allergy to any of those vaccine ingredients, like PEG or polysorbate. Very, very rare, but if you do, we recommend talk to your healthcare provider so that we can plan how you can get the vaccine in a safe way. Or if you've had a severe allergic reaction, like airways closing, can't breathe type of reaction to your first dose of a COVID vaccine, then we're gonna recommend caution in how you get the second dose. And we recommend that you talk to your healthcare provider. So what happens after receiving the vaccine? We still have to follow all of the public health measures, the things that all of us know so well after this year. Stay home as much as possible, keep our distance, wear a mask, and wash our hands often. This isn't going to be forever. There is a time in the future when most of the population will be vaccinated, where we can hug our loved ones, where we can, be close to our neighbors and our friends, but the time is not now, and we must keep up all of these public health interventions, okay? And why is that? Well, again, it's still unclear if we might be carrying the virus, and we're not sick, but we could pass it on to somebody else. As I mentioned, the vaccines are very, very, very effective, but they're not 100%. So we still have to be careful for that rare 5% or whatever it is. And then the other thing is that if we develop any symptoms of COVID, we still have to go for testing, even after you've received the vaccine. And even if it's like 2 days after receiving the vaccine, you may think, is this a side effect? Or is this because of COVID that I got exposed to before I got the vaccine and now I'm getting sick? right? So all of the same rules apply. Keep following those measures, and if you're sick, go for testing. A lot of questions about AstraZeneca. And I'm going to touch on this briefly. So you've seen reports around clotting concerns with AstraZeneca. What age, we're not sure. For now, Health Canada and the National Advisory Committee on Immunization has recommended that we pause giving the vaccine to individuals under the age of 55 while they are further reviewing the data to confirm that it's safe in this age group, because there were some rare circumstances of blood clots being observed in Europe. Now, this I can understand feels unsettling, right? But this is actually a good thing that our government, that our health agencies are saying, oh, there's a question. You know what? We're going to look further into that question. We're just going to put a pause on until we feel that we have enough information to answer that question. And again, this is what we often do in science. What they've established is that the blood clotting in people over the age of 55 is no higher after receiving the AstraZeneca vaccine compared to if you haven't received it. Blood clots happen. There wasn't any difference in those groups in the ages of over 55. So what's the plan for rollout and who's eligible? Again, I'm not going to get into the details of this because it's changing every 12 hours. What I say now may not be the case, but the basic premise is that, you know, we've started with our highest risk group, highest risk of becoming very sick, our seniors. That was phase one, elderly seniors in long-term care homes. Now it's coming down to seniors that are a bit younger. We're looking at people who have certain health conditions, people who live in congregate settings like shelters or group homes. We're starting to look at hotspot neighborhoods that have, and then looking at risks and age groups there. And then, you know, looking increasingly at essential workers who cannot work from home. So teachers, for other frontline workers who will soon be eligible for the vaccine. And a really important note is that the COVID-19 vaccines are free and an OHIP card is not required, okay? The government has made a commitment about this, so it is not dependent on your immigration status. And hopefully there will be more and more measures to make that clear on all the websites and at all of the sites where vaccines are being administered. I'm putting up this slide because this is our team at the Crossroads Primary Care Clinic. This is our group of nurses and doctors, and we all reviewed the vaccine information and all chose to receive the vaccine because we feel confident in its safety and its effectiveness. We feel immensely grateful that we had the opportunity to receive the vaccine. And, you know, I think we are engaging in a lot of this work because we want to ensure that people have the information about the vaccines so that they can make choices that feel right for them. I always tell my patients, your body, your choice. I just want to make sure you have accurate information to inform that choice. So I hope that through this presentation, I've been able to explain how the vaccines are well studied, safe, and effective, that many people are still at really high risk of COVID exposure because of work, transit, housing, and other circumstances. And then the vaccines are very effective in protecting you. So I'm happy to open up for questions now. One last little thing that I'll just highlight is there's so much information that's out there, but I've tried to collect a couple of resources that I think have like accurate and understandable and up-to-date information. So there are some multilingual handouts, and I'll share all of this with the group. Health Canada, Toronto Public Health, and actually Hamilton Public Health has an excellent question and answer, and it explains things in a very understandable way, and it might kind of address some of the questions you're encountering in your conversations. So I'm going to stop there and open up for questions.
Thanks so much, Vanessa. That was fantastic. Thank you for taking us through all of that. I think it was really helpful for many of us to get that grounding. We've got our first question already with a raised hand from Jamal from Roots. Go ahead, Jamal.
Hi, I'm Jamal, as you said. I had a few questions. The first one is surrounding the delay of the second dose of the vaccinations for Moderna and Pfizer. I was wondering if, are there any concerns that the efficacy of the second dose, which is now delayed, will prove to be less effective in like older, more vulnerable populations?
Such a great question, Jamal. Thank you. So, yeah, the interval has been expanded for a couple of reasons. The first and most important reason is that it's sort of an issue of equity, that we only have this supply of vaccines now. So how do we get the most number of people with some degree of protection? Maybe it's not the 95% from the trials, but 80% now, because we want to protect their life now. And so that's been a big part of the change in expanding that interval. If we get a flood of vaccine supply, they might say, oh, actually, we can shorten that again. We can do it in 3 months, or maybe for this group, we're going to do it in a shorter amount of time. So there's an evolving answer to your excellent question. I think the second part of that in terms of the effectiveness, it's actually an area of emerging evidence and study that there are some suggestions that actually expanding that interval may lead to an even more robust immune response. It actually might lead to like longer term and more protection. So it's something that's being studied, but what scientists feel confident in right now is that you're getting good lasting protection for at least those 4 months with that one dose. Now it's maybe not as high as with 2 doses after just receiving one, but again, this is about trying to get more people protected now. And I think it's all the more reason that we just have to continue all of these public health measures. Like when my parents who are in Alberta recently received the vaccine, I started crying on a webinar because I felt this huge sense of relief in knowing that they were receiving that protection, because I feel like every day I've worried about my parents so much, as I'm sure so many of you here have felt the same way about your family members and community members. But I also told them, I was like, you have to pretend like you did not get the vaccine. I want you to continue doing everything that you've done so well over this year. Please don't let your guard down now, especially because of these variants. So I know that's not maybe the most satisfying answer to your question, Jamal, but it's I would say that we can feel good about kind of getting the vaccines out, and that it's going to be okay, potentially even better that there's a delayed dose. We're continuing to learn about it.
Thank you so much. I also had one more question.
Yeah.
Is there a solid difference to the vaccines that are administered in, say, hospital settings versus, say, like a pharmacy?
Oh, great question. So solid difference in terms of like side effects and effectiveness, or just in like which ones are given where?
It's just which vaccine of the 3 now that are given?
Yeah, great question. So AstraZeneca is the one that's being administered in pharmacies. And then the mass vaccine sites and the ones that are through hospitals are Moderna and Pfizer. Maybe some of the community-based ones are going to be AstraZeneca. It sort of depends. Sometimes when there's a hospital group that's going out to a shelter, going out to a group home, out to a community agency, they may have Moderna or Pfizer. And the reason for that, much of it is around the stability of the vaccine. So those mRNA vaccines, Pfizer, Moderna, the mRNA, because it's just this temporary little instruction sheet, it's very unstable. So if it's not at the right temperature, even if it gets shaken, it falls apart. And so whereas the AstraZeneca and eventually the Johnson & Johnson, they are more stable. We can kind of like keep them in regular vaccine refrigerators. Doesn't have to be like a special a freezer. And so that's why there's the difference. Yeah, really good question. Thank you, Jamal.
Thank you. Sorry, I had one more, I forgot, if that's okay. So I know that there are a few like antibody isotypes, like immunoglobulin G, for example, that can pass through from a mother to like the placental lining. I was wondering if there are any like studies that show that, say, some type of antibodies developed, like anti-COVID SARS-CoV-2 vaccines, SARS-CoV-2 antibodies can pass through the placenta and like to a fetus.
So sorry, from the vaccine?
Yeah, like say developing antibodies from getting the vaccine.
Oh, okay. So can mom get the vaccine, develop immune protection, and pass that along to the growing fetus? Yes, Jamal, you were asking such great questions. I don't think I have all the answers because that's an area of emerging research. So I think this is the area of like pregnancy is that we're actively investigating. I mean, the scientific community, you know, not me, are actively investigating this. And so I don't think we have an answer to that right now, but the answer that we do have is around safety in terms of it not having like a theoretical mechanism to cause risk to the pregnant person or breastfeeding person or to the developing fetus. That's sort of what information we have. And hopefully in a few months, we'll have a better answer to your excellent question.
Okay, thank you so much.
Thank you.
Thanks. Arash, you've got your hand up.
Yeah, hi, Vanessa. Thank you so much for the amazing presentation. And I just had a quick question. So you mentioned the vaccine is free and no OHIP card is required. So that information was very useful for us. And I just wanted to know, like, how does the registration process work for, let's say, if someone is just visiting Canada, like on a visitor's visa, and they want to get vaccinated, like, is the process the same? Like, let's say they want to go to William Osler's hospital to get vaccinated. Like, what kind of ID would they require, if you have any information regarding that?
Oh, such a good question, Arash. And it's an area that I'm working on in collaboration with some other groups, including the Migrant Rights Network, to get some better clarification around all of these points, where it's a clear memo from the government. So I'm going to try and answer that question based on the information that I have so far in my conversations with the ministry. So one is, in terms of ID, people should be able to present different types of ID. It can be a government issued passport from another country. It doesn't even have to be valid. It can be a driver's license. Ideally, what they want is a photo ID, but there even should be, I hope it's emerging, flexibility on having like a letter from a community organization that just verifies the person's name and date of birth. And you know, they need that information just to say, one, like, you're eligible, and it's partly around being able to contact people so that they can get their second dose, right? So hopefully we should have more information about that. The very difficult thing, as you all know, is like, what is announced at the policy level, how does that actually translate onto the ground? And pharmacies already are not implementing this in a consistent way. So lots of work in advocacy, and actually I think kind of monitoring that we need to do around this. And as things emerge, I may actually ask you to report back to me so I can bring this to the ministry. The second part of your question, visitors. So the latest information that I've seen from the ministry is saying that somebody, if they work in Ontario or live in Ontario, you know, have some form of residency, or have been here for more than 16 weeks, they will be able to be eligible for the vaccine. Now, the reason for that, I think, is that the government is planning around not having people just fly in to get the vaccine and fly out. But the premise is anyone who lives and works in Ontario should be able to receive the vaccine if they meet the age, you know, neighborhood, like medical condition requirements. So they should be able, if you meet the eligibility, then it should apply. But there's still some work to be done to ensure that that policy is implemented.
Okay, perfect. Thank you. Yeah, if there's any updates in the future, please let us know. Thank you.
We're working on getting the ministry to issue a memo specifically on this because there's so much confusion, and we know that there are people being turned away who are eligible. So
okay, all right.
Thank you so much.
Thanks, Arash. We've got Jayshree and then Monique who have questions. I'm just checking that we've got 7 minutes left in the time. Dr. Reddit's able to stay a little bit longer. So if those who haven't had their questions answered want to stay on, we'll go for a few more minutes as well. Jayshree?
Yeah, just a couple of things. One, I noticed with the Region of Peel website yesterday that for anybody 65 and over, if they need transportation assistance, TransHelp can give them a ride free for their vaccines, which is really good to know. The other question I had, that I had was, I have had a couple of people in the community ask if for homebound people who are not able to get out to the vaccination sites, is there any service that will be able to give them the vaccine at their home? There has been questions in the news as well, and I'm not sure if that's been addressed yet.
Yeah, I'm afraid I may not be able to. You're in Peel, correct? You're speaking about Peel, yeah.
Yes.
So I may not be able to address that fully, but I think that there are efforts underway to try and develop solutions based in different communities for these homebound patients. So whether it's maybe paramedics going out and administering the vaccines, or having some cooperation with the LIN where home care can do it, or this sort of thing. So I think it's in the works, but it's such an important issue to address. Yeah, I'm sorry that I don't have a specific answer.
Because some of our seniors that are really elderly and very frail, it's hard for them to get out and wait in the lineups and stuff. That's what I've been hearing from the concerns out there.
For sure, yeah.
Jayshree, I think that's really helpful information. I know Paula from Peel is on the line as well. So this is all information that we're hoping to funnel up as Peel thinks about its mobile vaccine opportunities. So that's a really good flag for the team. So thank you. Monique, I think had the next question.
Yeah, thank you. Just in terms of, I guess, prevention and immune boosting, I've just noticed that there's not much talk around, eating immune boosting foods or taking vitamins. Is it something that we should consider and kind of make a priority as we also take the vaccine, or if we're not in line to take the vaccine yet? I'm just not hearing much around those pieces.
Yeah, thanks for that great question, Monique. I'm a big fan with my patients. I always say, I want you to be on the least number of medications that keeps you healthy. And so what are the ways that you do that? Well, it's eating healthy foods, lots and lots of vegetables, some fruits, healthy sources of protein, healthy grains. Make it something that you enjoy. Do it safely with the loved ones that you can. I don't particularly recommend any specific immune boosting foods. I think that the main premise is having a well-balanced diet. And I always tell people about the plate model, where half your plate should be vegetables and some fruits. So that's kind of my immune boosting nutrition. Getting good sleep, that is so, so important I see Jobin smiling about that. I think we're all not sleeping enough, right? But there's actually really good evidence about how good sleep helps to maintain your immune system. Actually managing stress in whatever ways you can helps to boost your immune system, or the corollary to that is if you're very stressed, not sleeping well, it actually suppresses your immune system. So, for stress management, a lot of it is about getting healthy exercise and doing the things that help you. In terms of specific vitamins, there isn't evidence around any specific vitamin supplements protecting against COVID. And again, my recommendation to my patients and to myself and to my family members is, if you're eating a well-balanced diet, and good nutrition, you're getting the vitamins and nutrients that you need from your food. Now, I also recognize, having said all of that, how difficult it is to afford and access nutritious food. That vegetables and fruits are some of the most expensive things. And so sometimes, problem solving with folks about like frozen fruits and vegetables have those nutrients. Can you, like, getting dried beans and lentils, very, very nutritious and more affordable. So those are, more detailed conversations in terms of how do you do that. But those are the general recommendations that I would give, and that I think I've sort of seen in the scientific studies.
We've got a question from Ravneet.
Yeah, I just want to ask, we have a query yesterday that if somebody has received their first dose of medication, can they call the hospital and get the second dose earlier? Or it has to be after 4 months?
Oh, okay. So, I think that we're actually all kind of waiting on that question. There's a possibility that interval may change. Like, again, it's possible that it may shorten to 3 months. It's possible that it could extend a bit. I think that's an area that we're still waiting on. For now, they're saying that the second dose will be in 4 months. There may be very particular circumstances, like in certain shelters or in certain long-term care homes for elderly, where those intervals are slightly different. But thus far, they also are not going to be engaging in a case-by-case basis where somebody says, well, I really need to see my grandchild, so I really need to get the vaccine earlier. Like, they just can't make those types of exceptions. So I think for now, what we can tell people is the plan right now is that it's approximately 4 month interval. But as if COVID has taught us anything, it's probably taught us many things, but it's taught us that things change and that we have to be flexible and we have to continue to adapt. So that recommendation, that guidance, that plan might change.
But just like, somebody, if they have a specific health condition and their like kind of family doctor recommends that they need the second dose early. So how that works?
If that healthcare provider is making that recommendation, then I think it's on the healthcare provider to navigate that. I would not recommend that that's something that you really need to get engaged in. And I think that would be the rare circumstances. Like, the circumstances that I'm thinking about for that is somebody who's received an organ transplant and they're planning their immunosuppressive therapy or they're planning their surgery. Like, those are the circumstances, but not for something like diabetes. So I think that type of question, I would say you should follow up with your family doctor, follow up with your oncologist, like follow up with your specific healthcare providers.
Thank you.
You're welcome. Great question.
So we've just hit 11 o'clock. Are there any other questions for Dr. Reddit?
I just want to say thank you very much. This is a very informative session and we all needed it. So thank you, Dr. Vanessa, and thank you, Chi.
Oh, well, thank you for the amazing work that you are doing. I have so much respect and admiration for the incredible connections that you're making in community and the role that you're playing in halting the pandemic and saving lives. I truly believe that. So thank you for what you're doing. And I'm so happy to meet with all of you. And I would be more than happy to come back to a future session and try and continue answering these questions.
Is there any last final questions before we close? Okay. Vanessa, thank you so much for being so generous with your time today and for taking us through some really good science data, et cetera. And I think giving us all lots of content that we can use when we're out talking to others to make them feel comfortable about the vaccines. I'm getting real excited to take my shot whenever that gets to happen. So thank you, everyone. We'll do another open session next Tuesday. If you have a particular theme or a topic that you want us to be posting the conversation around, let us know. Otherwise, we can do another kind of open session and see how things are going in the community as you know, lots of things shift and change. So see some of you next week, Tuesday. Thank you again, Vanessa, and speak to you all soon. Take care.
Thanks, everyone.
Thank you.
Stay safe.
Thank you.
Thank you.
Thank you.